internet, which can create biases in the sample. For instance, certain age groups or socioeconomic statuses may be underrepresented. 3. Privacy concerns. Collecting data online raises concerns about participant privacy and data security. Researchers must ensure they protect personal information and comply with ethical guidelines. Conclusion. Using the internet for experiments is a powerful way to conduct research quickly, cost-effectively, and with large sample sizes. This approach allows researchers to gather insights from diverse populations and improve the quality of their findings. However, they must also be aware of potential challenges related to data quality, sampling bias, and privacy. Understanding how to effectively use the internet for research is valuable for your success in the CPC exam and in your future academic and professional endeavors. Use of neuroscience. Sure, let's explore the use of neuroscience in psychology and mental health, focusing on its applications in diagnosis and treatment, male bias in research, and the connection between the microbiome and mental health. We will break down each concept to make it easy to understand. What is neuroscience? Neuroscience is the study of the nervous system, including the brain, spinal cord, and nerves. It helps us understand how the brain works, how it affects behavior and emotions, and how various factors influence mental health. 1. Diagnostic and treatment orientation. Diagnostic and treatment orientation refers to how neuroscience is used to identify mental health conditions and develop effective treatments. Brain imaging. Neuroscientists use techniques like MRI and PET scans to look at brain structure and activity. These tools help doctors find out if there are any abnormalities in the brain that could indicate mental health issues. Example, an MRI scan might reveal that a person with depression has changed patterns in certain brain areas, which can help doctors understand what treatments might work best. Targeted treatments. Understanding how the brain functions allows researchers and clinicians to create targeted treatments. For instance, certain therapies and medications can be tailored to address specific brain areas or neurochemical imbalances. Example, if research shows that people with anxiety have lower levels of serotonin, a doctor may prescribe medication that increases serotonin levels to help relieve symptoms. 2. Male bias in neuroscience research. Male bias refers to the tendency for research studies, including those in neuroscience, to focus more on male subjects than female subjects. Historical context. Traditionally, many studies have included only male participants, leading to a lack of understanding of how mental health conditions and treatments might affect women differently. Impact on treatment. This bias can result in treatment plans that are based on male responses and may not be as effective for women. For example, certain medications may affect men and women differently, but if only men were studied, the dosage or type of medication prescribed for women might not be optimal. Example, a study showing how a specific medication worked for men may not consider hormonal differences in women, potentially leading to side effects or reduced effectiveness in female patients. 3. Microbiome mental health connection. The microbiome refers to the community of microorganisms that live in our bodies, especially in the gut. Recent research has found connections between the microbiome and mental health. Gut-brain axis. This term describes the communication pathway between the gut and the brain. The microorganisms in the gut can produce chemicals that influence brain function, mood, and behavior. Impact on mental health. Changes in the gut microbiome have been linked to various mental health issues, such as depression and anxiety. For example, if an individual has an imbalance of healthy bacteria in their gut, it might affect their mental well-being. Example, studies have shown that probiotics might help improve mood and reduce symptoms of anxiety by positively influencing gut health. Conclusion. The use of neuroscience in psychology and mental health research has opened up new ways to diagnose and treat mental health conditions. By understanding brain function and structure, researchers can develop targeted treatments. However, issues like male bias in research remind us that it's essential to consider diverse populations in studies. Additionally, the microbiome's connection to mental health highlights the complex interactions between physical health and mental well-being. As you prepare for your CPC exam, grasping these concepts will help you understand how neuroscience informs psychological practice and research. Types of research and experimental design. Experimental research. Sure, let's explore experimental research and how it helps establish cause and effect relationships. This is an important concept in psychology and scientific studies. We'll break it down into key ideas, important details, and examples to make it easier to understand. What is experimental research? Experimental research is a type of study that aims to determine whether one variable causes a change in another variable. Researchers manipulate one variable, called the independent variable, and observe the effect on another variable, known as the dependent variable. Key concepts of experimental research. 1. Cause and effect. Experimental research helps identify whether changes in one variable cause changes in another. It answers questions like, does adding a certain substance to plants help them grow faster? Example, if a researcher wants to find out if studying with music improves test scores, they might create two groups, one that studies with music and another that studies without music. By comparing the test scores of both groups, the researcher can see if music causes a change in performance. 2. Independent and dependent variables. Independent variable. This is the variable that the researcher changes or manipulates. In a music example, the independent variable is whether the students study with music or without it. Dependent variable. This is the outcome that is measured in the experiment. It is affected by changes in the independent variable. In our example, the dependent variable is the students' test scores. 3. Control group versus experimental group. Control group. This group does not receive the treatment or manipulation. It serves as a baseline to compare against the experimental group. Experimental group. This group receives the treatment or manipulation being tested. Example. In the study above, students studying without music would be in the control group, while those studying with music would be in the experimental group. 4. Random assignment. Randomly assigning participants to different groups helps ensure that the results are not biased by other factors, like age, gender, or prior knowledge. This means every participant has an equal chance of being placed in either group. Example, if 30 students are participating in the study, a researcher might use a random number generator to determine which students will learn with music and which will not. Importance of experimental research. Experimental research is important because it allows researchers to 1. Establish causation. By manipulating the independent variable and observing the results in a controlled environment, scientists can make stronger claims about what causes what. This helps differentiate between correlation and causation. Example, if the students with music perform significantly better than those without it, the researcher may conclude that listening to music while studying is likely to improve scores. 2. Control extraneous variables. Researchers can control for other variables that might affect the results. This is done by keeping conditions the same for all participants. Example, ensuring all students study for the same amount of time and have similar materials can help control for other influences on test scores. Ethical considerations in experimental research. While conducting experiments, researchers must consider ethical guidelines. Informed consent. Participants should understand what the study involves and agree to participate willingly. Debriefing. After the experiment, participants should be informed about the study's purpose and any potential impacts. Avoiding harm. Researchers must ensure that participation does not harm the participants mentally or physically. Conclusion. Experimental research is a powerful tool for establishing cause and effect relationships. By manipulating one variable and observing its impact on another while controlling other factors, researchers can gain valuable insights into how different elements interact. Understanding experimental research is essential for your studies in psychology and will help you effectively analyze and interpret scientific findings, which is particularly relevant for your CPC exam. Treatment conditions controlled by the experimenter. Sure, let's explore the topic of treatment conditions controlled by the experimenter, which is a crucial aspect of experimental research. Understanding this concept is important for designing experiments that can effectively test hypotheses and ensure reliable results. What does it mean to control treatment conditions? In experimental research, treatment conditions refer to the specific circumstances or interventions that participants experience during the study. When we say that the experimenter controls treatment conditions, it means that the researcher has the authority to determine how these conditions are applied to participants. This control is essential for establishing clear cause and effect relationships. Key concepts. 1. Manipulation of the independent variable. The experimenter directly manipulates the independent variable to see how it affects the dependent variable. This is a key feature of experimental research. Example: in a study to test the effectiveness of a new medication, the experimenter decides the dosage given to participants. This dosage is the treatment condition being controlled by the experimenter. 2. Standardized conditions. The experimenter ensures that all participants are exposed to the same treatment conditions during the experiment. This includes factors like the environment in which the experiment takes place, the time of day, the instructions given, and the equipment used. Example: in a study examining the impact of sleep on memory, the experimenter might ensure that all participants study in the same room, at the same time of day, and receive identical study materials. 3. Control group versus experimental group. In many experiments, there are at least two groups, the experimental group and the control group. The experimenter controls these groups to compare outcomes effectively. Example: if researchers want to test a new teaching method, one group of students might receive the new method, while another group continues with traditional teaching. By controlling which group gets which treatment, the researchers can determine the effectiveness of the new method. 4. Random assignment. This involves randomly placing participants into different groups to ensure that any differences between the groups are due to the treatment itself and not other factors. Example: if 100 students participate in a study, the researcher could use a random number generator to assign half to the experimental group and half to the control group. This helps make sure that the groups are similar in important ways, like age or prior knowledge. Importance of controlling treatment conditions. 1. Establishing cause and effect relationships. By controlling treatment conditions, researchers can confidently determine whether changes in the dependent variable are actually caused by the independent variable. This clarity is crucial in experimental research. Example: if students taught using a new method perform better on tests than those taught using traditional methods, the researcher can reasonably conclude that the new teaching method causes improved performance. 2. Reducing confounding variables. Confounding variables are outside factors that could influence the results of an experiment. By controlling treatment conditions, researchers can minimize the impact of these variables and ensure that the results are valid. Example: if studying the effects of a new exercise program, the experimenter might control for diet by providing all participants with the same meals, ensuring that any weight loss is due to exercise rather than diet differences. 3. Enhancing replicability. When treatment conditions are well controlled, other researchers can replicate the study to see if they get the same results. This is essential for validating findings in science. Example: if a study on medication effectiveness provides clear treatment conditions, other scientists can repeat the study under the same conditions to confirm or challenge the findings. Conclusion: controlling treatment conditions is a vital element of experimental research that allows researchers to manipulate variables, establish cause and effect relationships, and produce reliable results. By ensuring that all participants experience the same circumstances during the experiment, and by carefully comparing experimental and control groups, researchers can draw meaningful conclusions. Understanding this concept will help you analyze and evaluate experimental designs effectively, which is particularly useful for your CPC exam preparation. Random assignment. Certainly, let's delve into the topic of random assignment, also known as randomization, which is a fundamental concept in experimental research. Understanding this concept is crucial for ensuring the validity of research findings. We'll break it down into key ideas, important details, and examples. What is random assignment? Random assignment is a process used in experimental research to place participants into different groups in a way that is completely random. This means that each participant has an equal chance of being placed in any group, helping ensure that the groups are similar at the start of the experiment. Why is random assignment important? 1. Minimizes bias. Random assignment helps to eliminate bias that could affect the outcomes of the study. By randomly assigning participants, researchers can ensure that no systematic differences exist between the groups that could influence the results. Example: If a researcher is studying the effects of a new teaching method, they might randomly assign students to a group using the new method and a control group that continues with the old method. This way, any differences in test scores can be attributed to the teaching method rather than differences between students. 2. Controls for confounding variables. Confounding variables are factors other than the independent variable that could affect the dependent variable. Random assignment helps distribute these confounding variables evenly across groups. Example: suppose a study looks at the effects of a drug on reducing anxiety. If participants were not randomly assigned, one group might have more people with severe anxiety than the other, leading to skewed results. Random assignment ensures that both groups have a mix of severity levels. 3. Enhances generalizability. When participants are randomly assigned to groups, the findings of a study are more likely to apply to a broader population. This adds to the overall credibility of the research. Example: a study conducted with randomly assigned participants can make stronger claims about the effectiveness of a treatment across different demographics, as randomization helps ensure a diverse representation in the sample. How random assignment works. 1. Sampling. Before random assignment, researchers typically start by selecting a sample of participants from a larger population. This sample should represent the population being studied. Example: a school might select 100 students from various grades and backgrounds to study the effects of a new curriculum. 2. Random selection. Researchers use random methods to assign each participant to different groups. Example: if 100 students are part of a study, the researcher could number the students and use a random number generator to assign 50 of them to the experimental group and the other 50 to the control group. Examples of random assignment in research. 1. Drug trials. In a clinical trial testing a new medication, researchers randomly assign participants to receive either the medication or a placebo. Randomization helps ensure that any differences in health outcomes can be attributed to the medication and not other factors. 2. Educational studies. A researcher wants to evaluate a new teaching strategy. They select a group of students and randomly assign half to learn using the new strategy and the other half to use traditional methods. This way, the researcher can compare test scores and determine if the new strategy is effective. Challenges and limitations. While random assignment is a powerful method, it can have limitations. 1. Feasibility. In some situations, it may not be practical or ethical to randomly assign people. Researchers must consider ethical guidelines when using random assignment. 2. Sample size. Random assignment works best with larger sample sizes to ensure that groups are similar. Smaller samples may not achieve true randomization, which could lead to unintended bias. Conclusion. Random assignment, or randomization, is a critical aspect of experimental research that helps ensure the reliability and validity of study findings. By randomly assigning participants to different groups, researchers can minimize bias and control for confounding variables, leading to more trustworthy conclusions about the effects of treatments or interventions. Understanding random assignment will help you analyze research designs and results more effectively, which is particularly valuable as you prepare for your CPC exam. Elimination of extraneous variables. Absolutely. Let's take a closer look at the elimination of extraneous variables in the context of experimental research. This is an important concept to understand because it helps ensure that research findings are valid and reliable. We'll break it down into key ideas, important details, and examples. What are extraneous variables? Extraneous variables are any variables other than the independent variable that might affect the dependent variable in an experiment. These are variables that researchers do not want to influence the outcome of the study. If not controlled, extraneous variables can lead to misleading results. Why eliminate extraneous variables? 1. Validity of results. When extraneous variables are present, it becomes difficult to determine whether changes in the dependent variable are truly caused by the independent variable. Eliminating these variables helps clarify the cause and effect relationship. Example: if a study is testing a new educational method but doesn't control for students' prior knowledge of the subject, any difference in test scores might be due to what students already knew rather than the new teaching method. 2. reduces confounding effects. Controlling extraneous variables helps prevent them from confounding the results. A confounding variable is an extraneous variable that is related to both the independent and dependent variables and can distort the study findings. Example: if a researcher is studying how a new diet affects weight loss, not controlling for exercise could be a confounding variable. If participants exercise more while on the diet, it may not be clear if weight loss is due to the diet itself or increased exercise. 3. Increases reliability. When extraneous variables are kept consistent across participants, it increases the reliability of the study. Researchers can be more confident that their findings are consistent and replicable. Example: in a study examining the effects of a noise reduction device on concentration, if some participants work in a quiet room and others in a noisy environment, the results will be unreliable. Controlling the setting helps ensure that all participants are experiencing the same conditions. How to eliminate extraneous variables. Researchers can use several strategies to eliminate or control extraneous variables in their studies. 1. Randomization. Randomly assigning participants to different groups helps spread extraneous variables evenly across groups. This minimizes their effects since each participant has an equal chance of being assigned to any group. Example: if studying the impact of a new app on productivity, researchers might randomly assign users to either use the app or not, ensuring that both groups have varied backgrounds and traits. 2. Control groups. Using control groups allows researchers to compare the experimental group with a group that does not receive the treatment. The control group helps identify the effect of extraneous variables. Example: in a study testing a new medication, the control group might receive a placebo. Any differences in outcomes can be compared with those in the experimental group that receive the medication. 3. Standardization. Keeping all conditions the same for all participants is crucial. This can include the environment, timing, materials used, and procedures followed during the experiment. Example: if studying how temperature affects plant growth, researchers must ensure all plants are in the same light and water conditions, as well as having the same type of soil, so that any growth differences are solely due to temperature variations. 4. Statistical control. Researchers can use statistical techniques to account for extraneous variables that can't be eliminated entirely. This involves using statistical methods to analyze and adjust for the effects of these variables. Example: in a study examining the impact of a training program on job performance, researchers may use a statistical technique to control for factors like previous job experience or education level. Conclusion: eliminating extraneous variables is critical in experimental research to ensure that the results are valid and reliable. By controlling or minimizing these variables, researchers can more confidently determine that any changes in the dependent variable are indeed due to the independent variable being tested. Understanding this concept will be highly valuable for your preparation for the CPC exam, as it helps you analyze research and understand the integrity of various studies. Sure, let's dive into the topic of quasi-experiments. A quasi-experiment is an important research design used in psychology and other fields. We'll break it down into key concepts, important details, and examples to make it easy to understand. What is a quasi-experiment? A quasi-experiment is a type of research design used to study the effects of an intervention or treatment when random assignment of participants to different groups is not possible. This means that researchers work with pre-existing groups instead of randomly creating groups and cannot alter the independent variable in the same way they would in a true experiment. Key concepts of quasi-experiments. 1. Pre-existing groups. In a quasi-experiment, the groups being studied already exist and are not formed by random assignment. These groups could be based on characteristics such as age, gender, education level, or other natural groupings. Example: researchers might use two different classes in a school, where one class uses a new teaching method and the other continues with a standard method. The researchers did not randomly assign students to classes. The classes already existed. 2. Independent variable cannot be altered. Unlike in true experiments, where researchers can manipulate the four, quasi-experiments do not allow for this level of control. Instead, researchers observe how an independent variable affects groups without changing it or assigning participants randomly. Example: if researchers want to study the effects of a new counseling program on stress levels, they might compare a group of people who have already enrolled in the program with those who have not. The program is not randomly assigned or manipulated. Why use quasi-experiments? 1. Practicality. Sometimes, it is not feasible or ethical to randomly assign participants to different groups. For example, you cannot randomly assign students to different schools based on a new educational approach. Example: a researcher wants to examine the impact of smoking cessation programs in different communities. It is not ethical to randomly assign individuals to smoke or not smoke, so they compare existing smokers who participated in a program with those who did not. 2. Real-world settings. Quasi-experiments often take place in natural settings, making the findings more applicable to real-life situations. They allow researchers to study the effects of treatments in the environments where they would typically be used. Example: a study might assess the effectiveness of a substance abuse program at a local rehab center. Researchers can compare outcomes for clients currently enrolled with a similar group that did not participate in the program. 3. Time and resource constraints. Conducting true experiments can often be time-consuming and resource-intensive. Quasi-experiments can provide useful insights more quickly. Example: a school district wants to evaluate a new reading program. Instead of testing randomly assigned groups over several months, they can simply analyze performance results from schools that adopted the program compared to those that did not. Limitations of quasi-experiments. 1. Threats to internal validity. Since participants are not randomly assigned, there may be confounding variables that affect the results. Differences between groups that are not controlled can lead to skewed results. Example: in a previous study comparing reading programs, if one school has more experienced teachers than another, it may impact students' performance, making it hard to determine if the program itself was effective. 2. Causation versus correlation. Quasi-experiments can show associations between variables, but are less reliable for establishing cause and effect relationships than true experiments. Example: if students in one program perform better, it might be due to other outside factors rather than just the program itself. Conclusion: quasi-experiments are valuable research methods that allow researchers to study effects in real-world settings when random assignment is not possible. By using pre-existing groups, they can gain insights into the effectiveness of interventions and programs while acknowledging the limitations in establishing causation. Understanding quasi-experiments is important for analyzing research designs and findings, especially for your upcoming CPC exam. Inability to confidently state causality with statistical certainty. Sure, let's talk about the inability to confidently state causality with statistical certainty. This is an important concept in research and statistics, particularly when interpreting the results of studies. We will break it down into key concepts, important details, and examples to make everything clear. What does causality mean? Causality refers to the relationship between two events where one event directly influences another event. For example, if eating more fruits and vegetables leads to better health, we would say there is a causal relationship between diet and health. The challenge of establishing causality. 1. Correlation versus causation. Just because two things occur together does not mean that one causes the other. Understanding this difference is crucial in research. Example: if a study finds that people who drink more coffee have higher levels of happiness, it does not mean that drinking coffee causes happiness. There could be other factors at play, such as overall lifestyle or social connections. 2. Statistical association. Researchers often use statistics to analyze data and look for associations between variables. However, a statistical association alone does not prove that one variable causes the other. Example: in a study showing a link between exercise and reduced anxiety, the results might indicate that people who exercise tend to report lower anxiety levels. However, this does not confirm that exercise directly causes lower anxiety. Other factors, like social support or better sleep, might be influencing both. 3. Confounding variables. Confounding variables are outside factors that can affect the relationship between the independent and dependent variables. If not controlled, they can mislead the interpretation of results. Example, in drug studies. If researchers find that a new medication lowers depression but don't account for participants' varying therapy sessions, they may mistakenly conclude that the medication alone is effective when therapy might be a significant factor. 4. Experimental design. The design of a study influences the ability to claim causality. True experiments, where participants are randomly assigned to groups, provide stronger evidence for causation because they control for other variables. Example, in a study examining the effects of a new teaching method, if students are randomly assigned to different groups, researchers can be more confident that differences in learning outcomes are due to the teaching method rather than other factors. 5. Limitations of observational studies. Many studies are observational rather than experimental, meaning they observe participants without manipulating any variables. While observational studies can show correlations, they cannot establish causation with certainty. Example, a researcher might observe that higher income is associated with better mental health in a community. But without an experimental approach, it's hard to claim that increased income directly causes improved mental health. Importance of understanding causality limitations. 1. Making informed decisions. In psychology and other fields, understanding the limitations of research helps professionals make informed decisions based on the evidence available. Knowing that correlation does not equate to causation encourages more cautious interpretations of study results. Example, a therapist might be cautious in recommending a new anxiety treatment based solely on preliminary results suggesting effectiveness if those results do not control for external factors. 2. Further research needs. Acknowledging the inability to confidently state causality motivates researchers to conduct further studies, often using randomized controlled trials to gain more robust evidence. Example, if initial studies find a link between sleep quality and academic performance, researchers might conduct RCTs where they improve students' sleep and then measure changes in academic performance to explore causality more deeply. 3. Avoiding misinterpretation. By recognizing that statistics alone cannot confirm causality, researchers, practitioners, and the public can avoid overgeneralizing findings or making incorrect assumptions about relationships in complex systems. Example, if a study finds that children who play video games perform worse in school, it wouldn't be accurate to claim that playing video games causes poor academic performance without considering other factors, like time spent on homework or parental involvement. Conclusion. The inability to confidently state causality with statistical certainty is a critical concept in research and statistics. Understanding the difference between correlation and causation and being aware of the influence of confounding variables allows researchers and practitioners to interpret study results more accurately. This understanding is essential for developing reliable conclusions and making informed decisions in various fields. Being aware of these limitations will be beneficial as you prepare for your CPC exam and evaluate research throughout your education and career. Ex post facto study. Sure, let's explore the topic of ex post facto studies, which is an important concept in research methods, particularly in the fields of psychology and social sciences. We'll break it down into key ideas, important details, and examples to make everything clear. What does ex post facto mean? The term ex post facto is Latin for after the fact. In research, it refers to a type of study where researchers look back at events or conditions that have already occurred rather than manipulating or controlling them. Essentially, researchers study the effects of an independent variable after it has already happened. Key concepts of ex post facto studies. 1. Observational research. Ex post facto studies are non-experimental and observational. Researchers do not apply any treatment or intervention. Instead, they observe and analyze existing data or conditions. Example, a researcher might investigate the effects of a natural disaster on community mental health by examining individuals' reports and responses after the disaster has occurred. 2. Causal relationships. In ex post facto research, the goal is often to identify possible causal relationships between variables. However, this type of study can show correlations, but cannot definitively establish causation due to potential confounding variables. Example: a study might examine whether people who experienced a major life change, like moving to a new city, report higher stress levels compared to those who did not. While researchers can explore the relationship, they cannot say moving causes stress definitively since they did not manipulate the situation. 3. Utilizing existing groups. Researchers often use pre-existing groups or data in ex post facto studies. They cannot randomly assign participants to groups, which limits their ability to control for extraneous variables. Example: a researcher might compare academic performance between students who attended different high schools. The schools are already established, so the researcher uses those groups to examine any performance differences. 4. Limitation of control. Because ex post facto studies rely on already existing groups and conditions, researchers have limited control over factors that may influence the results. This is different from experimental research, where researchers manipulate variables. Example: if studying the impact of a historic event on a community's development, it's impossible to control factors like economic status or education levels that might also affect development. Advantages and disadvantages of ex post facto studies. Advantages: 1. Ethical considerations. Ex post facto studies can address ethical concerns since researchers do not manipulate situations that could cause harm to participants. This is particularly useful when dealing with sensitive issues or variables that cannot be tested experimentally. Example: researchers examining the long-term effects of childhood trauma can analyze existing data without putting children in potentially harmful situations. 2. Practicality. These studies can be more practical and feasible in many cases since researchers can use existing data and do not need to conduct time-consuming experiments. Example: public health officials might review historical health records to study the impact of a vaccination program without needing to set up a new experimental study. Disadvantages: 1. Limited causation evidence. One of the primary drawbacks of ex post facto studies is that they cannot provide strong evidence of causation. Researchers may identify relationships, but cannot confidently determine that one factor directly causes another. Example: if a study finds that individuals who regularly consume fast food have higher obesity rates, it doesn't mean fast food consumption causes obesity, since many other factors, like lifestyle and genetics, could better explain the relationship. 2. Potential for bias. Data collected from existing sources may be biased or incomplete, affecting the reliability of the study's conclusions. Example: if a study relies on self-reported data, such as individuals recalling their childhood experiences, the accuracy of that data can vary widely from person to person. Conclusion: ex post facto studies are valuable research designs that explore relationships between variables after events have occurred. While they can provide insights into correlations and associations, researchers must be cautious in interpreting results due to the limitations in establishing causality and controlling extraneous variables. By understanding ex post facto studies, you can better analyze research findings and critically evaluate their implications, which will be helpful as you prepare for your CPC exam. Internal and external validity. Absolutely. Let's explore the concepts of internal validity and external validity in research. These terms are crucial for understanding how to evaluate the quality of a study and the reliability of its findings. We'll break down these concepts into key points, important details, and examples to make them clear. What is internal validity? Internal validity refers to the extent to which a study can show that changes in the independent variable are directly responsible for changes in the dependent variable. In other words, it assesses whether the study accurately demonstrates a cause and effect relationship within the specific context of the research. 1. Control of variables. To achieve high internal validity, researchers need to control for extraneous variables that might affect the results. This means ensuring that any changes in the dependent variable are likely due to the manipulation of the independent variable alone. Example: in a study testing a new medicine, researchers control for the age, health conditions, and lifestyle of participants to isolate the effect of the medication on their health. 2. Random assignment. Using random assignment of participants to different groups helps enhance internal validity. This process reduces the likelihood that differences between groups will affect the results. Example: if students are randomly assigned to either a new teaching method or a traditional method, any differences in student performance can be more confidently attributed to the teaching method rather than other factors. 3. Threats to internal validity. Several factors can threaten internal validity, such as confounding variables, selection bias, maturation, and history. Example: if a study examines the effects of a training program, but participants also receive additional coaching during the study, it's hard to determine whether improvements are due to the training program alone. What is external validity? External validity refers to the extent to which the results of a study can be generalized to, or have relevance for, settings, people, times, and measures outside of the specific conditions of the research. It focuses on whether the findings of a study can be applied in real-world situations. Key points about external validity. 1. Generalizability. High external validity means that the findings of a study can be applied to the broader population beyond the study sample. This includes different people, environments, and times. Example: if a study on teaching strategies conducted in one school can be applied to different schools with varying demographics and settings, it has high external validity. 2. Representative samples. To increase external validity, researchers should use samples that are representative of the population they want to generalize to. This could involve ensuring diversity in the sample regarding age, gender, ethnicity, etc. Example: a survey about eating habits conducted on a group of students in one high school may have low external validity if the findings are intended to apply to all high school students across the country. 3. Real-world settings. Conducting studies in realistic settings can enhance external validity. If research takes place in a natural environment rather than a lab, the findings are more likely to reflect real-world conditions. Example: studying customer behavior in an actual restaurant rather than a simulated environment increases the chances that the results apply to real dining scenarios. Balancing internal and external validity. 1. Trade-offs. There's often a trade-off between internal and external validity. For example, highly controlled laboratory experiments may provide strong evidence for causality, but may not reflect real-world situations. Example: a laboratory experiment on stress might measure physiological responses to stress in a controlled environment, providing strong internal validity, but it may not capture how individuals deal with stress in everyday life. 2. Aiming for both. Researchers strive to design studies that have both high internal and external validity. This might involve carefully planning the research design, using appropriate sampling techniques, and considering the setting of the study. Example: a field study on the effects of a new educational program could be designed in a school setting while controlling for factors like teacher experience to ensure that any observed effects are due to the program itself. Conclusion: internal validity and external validity are crucial concepts in research that help determine the quality and applicability of study findings. Internal validity focuses on whether the study effectively demonstrates cause and effect relationships, while external validity concerns how well the results can be generalized to other contexts. Understanding these concepts will enhance your ability to evaluate research critically, an important skill for your CPC exam and future career in the helping professions. Threats to internal validity. Sure, let's break down the threats to internal validity, particularly focusing on maturation of subjects, mortality, and instruments. Understanding these threats is crucial for evaluating the reliability of research findings. We'll provide key concepts, important details, and examples to clarify these ideas. What is internal validity? Internal validity refers to the extent to which a study correctly demonstrates a cause and effect relationship between the independent variable and the dependent variable. Threats to internal validity can introduce biases or alternative explanations that undermine the confidence in those relationships. Key threats to internal validity. 1. Maturation of subjects. Definition: maturation refers to the natural changes that occur in participants over time, which can affect the study's outcome. This is particularly significant in long-term studies or those involving young participants. How it affects validity. If participants are observed over time, their development, aging, or changes in health may influence the study's results, regardless of the treatment or intervention applied. Example: imagine a study assessing the effectiveness of a new educational program on children's reading skills over one school year. If the children improve their reading abilities, it might be due to the program or simply because they naturally develop reading skills as they grow older. This age-related improvement can confound the results. 2. Mortality. Definition. Mortality refers to the loss of participants from a study over time. This can occur for various reasons, such as participants dropping out, moving away, or losing interest in participating. How it affects validity. If certain groups of participants drop out at different rates, it may skew the results and affect the ability to make valid conclusions about the intervention's effectiveness. Example: in a clinical trial testing a new medication, if a disproportionately high number of people who experience side effects drop out of the study, the remaining participants may not accurately represent the larger population, leading researchers to incorrectly conclude that the medication is safer than it actually is. 3. Instruments. Definition. Instruments refer to the tools used to measure the dependent variable. Changes in how the instruments work or how they are applied can threaten internal validity. How it affects validity. If the measurement tools are not consistent or change during the study, it may lead to differences in results that are unrelated to the effects of the independent variable. Example: suppose a study is measuring students' math skills using a specific test. If the researchers decide to change the format of the test halfway through the study, any differences in scores may be attributable to the change in the test rather than actual changes in math skills. Addressing threats to internal validity. Understanding these threats helps researchers design studies that minimize their impact. Here are some strategies to address them. 1. Controlling for maturation. Researchers can use shorter study durations or incorporate control groups that do not receive the treatment, allowing for comparisons and reducing the impact of natural development over time. Example: in a long-term study, researchers might compare the development of children participating in the educational program with a control group of children who are not participating and are of similar age. 2. Minimizing mortality. To reduce participant dropout rates, researchers can create engaging study protocols, maintain regular communication with participants, and offer incentives for continued participation. Example: in a clinical trial, providing participants with regular updates on findings or small rewards for completing the study may encourage them to stay involved. 3. Standardizing instruments. Researchers should use the same measurement tools throughout the study and ensure they are calibrated correctly. Training for those administering the instruments also helps maintain consistency. Example: if a study employs surveys to measure participants' mental health, researchers should ensure that all surveys are administered in the same manner, without changes in questions or format during the study. Conclusion. Threats to internal validity, including maturation of subjects, mortality, and instruments, can affect the accuracy of research findings. By understanding these concepts, you can critically evaluate research studies and identify potential biases or limitations in the findings. This knowledge will be helpful for your CPC exam and in your future studies and practice in the field of psychology. External validity. Sure, let's dive into the concept of external validity, which is essential for understanding how research findings can be applied to wider populations and real-world situations. We'll break it down into key concepts, important details, and examples to make it clear. What is external validity? External validity refers to the extent to which the results of a study can be generalized or applied to settings, people, times, and measures beyond the specific conditions of the research. In simpler terms, it means how well the findings from a study can be applied to the real world or to other groups of people. Key concepts of external validity. 1. Generalizability. Generalizability means that the study's findings are not just specific to the sample used, but can be relevant to a larger population. High external validity indicates that the results can apply to different people or contexts. Example: if a study finds that a new teaching method improves student performance in one school, high external validity would suggest that this method could also work in other schools with different students. 2. Representative samples. To enhance external validity, researchers should use samples that accurately represent the larger population they want to generalize to. A diverse and well-chosen sample helps ensure that findings are applicable to various groups. Example: if researchers want to study the effects of a new exercise program on physical health, they should include participants from various age groups, genders, and fitness levels. This way, the results can be generalized to the broader community. 3. Real-world settings. Conducting research in natural or real-world environments can improve external validity. If findings are obtained in more realistic settings, they are more likely to apply to everyday situations. Example: a study examining the impact of a new public health campaign might be conducted in an actual community rather than a lab setting. This approach increases the likelihood that the results will be applicable to other communities. Factors affecting external validity. 1. Sample characteristics. The characteristics of the study participants can affect how generalizable the results are. If the sample is too homogeneous, it may not reflect the diversity of the larger population. Example: a study on college students' stress levels conducted only at one university may not be generalizable to all college students, especially those attending different types of institutions, such as community colleges or universities in different regions. 2. Context of the study. The specific conditions under which the study is conducted can influence external validity. Results may vary based on these factors. Example: if a study examining seasonal allergies is conducted in the spring in one region, the findings may not apply to people living in different climates or to those experiencing allergies in the fall. 3. Time and timing. The timing of the study can also affect its external validity. For instance, findings from a study conducted during a specific event may not be applicable once the situation changes. Example: a study about stress levels during a specific economic crisis may not hold true once the crisis is over or in different economic circumstances. Improving external validity. To improve the external validity of research, researchers can: 1. Use diverse samples. Include participants from different backgrounds and locations to ensure the findings are applicable to a wider population. Example: when studying a new mental health treatment, researchers could include participants from various demographic groups, including different ages, ethnicities, and socioeconomic backgrounds. 2. Conduct field studies. Carry out studies in natural settings rather than controlled environments to enhance generalization. Example: testing a new community intervention to promote healthy eating directly in neighborhood settings rather than in a sterile lab. 3. Replicate studies. Conduct the same study in different locations and with different populations to confirm that results are consistent across groups. Example: if an educational intervention shows success in one school, replicating the study in different schools can help validate that the method is effective more broadly. Conclusion: external validity is crucial for determining how well research findings can be generalized to broader populations and real-world situations. Understanding external validity helps researchers design studies that are applicable to diverse groups and contexts. This knowledge will be helpful as you analyze research in your studies and for your CPC exam, ensuring you can assess how relevant the findings may be in various real-life situations. Factorial analysis. Sure, let's explore the concept of factorial analysis, which is a statistical method used to summarize and understand complex data. This will help you see how different variables interact with one another and how to analyze them effectively. We will break it down into key concepts, important details, and examples to make it clear. What is factorial analysis? Factorial analysis is a technique used in statistics to explore how multiple variables affect a particular outcome or dependent variable. This method helps researchers understand the relationships between different factors and how they contribute to variations in the data. Key concepts of factorial analysis. 1. Factors. In factorial analysis, factors refer to the different independent variables that are being studied. These can be categorical or continuous. Example: consider a study examining the effects of study habits and teaching style on students' test scores. Both study habits and teaching style are factors in this analysis. 2. Interaction effects. One of the main purposes of factorial analysis is to identify whether interaction effects exist between the factors. An interaction effect occurs when the effect of one factor on the dependent variable changes depending on the level of another factor. Example: if students who study more hours perform better in classes taught interactively, but the same increase in study hours doesn't affect those taught traditionally, that shows an interaction effect between study habits and teaching style. 3. Dependent variable. The dependent variable is the outcome being measured in the study. It is the variable that researchers are trying to understand or predict based on the influence of the factors. Example: in the earlier example, the dependent variable could be students' test scores, which researchers measure to see how they are affected by study habits and teaching styles. 4. Main effects. Main effects refer to the individual impact of each factor on the dependent variable, without considering other factors. It shows how much each factor contributes to the outcome. Example: if analyzing the data shows that increased study time increases test scores across all teaching styles, that indicates a main effect of study time. Importance of factorial analysis. 1. Understanding complex relationships. Factorial analysis allows researchers to examine how multiple variables interact simultaneously, leading to a more comprehensive understanding of the data and results. Example: in a psychology study, researchers could analyze how different treatments along with demographics impact recovery rates from depression. The analysis can reveal which combinations are most effective. 2. Designing experiments. This method is useful for designing experiments and studies that involve more than one factor, helping researchers structure their research effectively. Example: if a company wants to test different marketing strategies based on customer age and product type, factorial analysis helps in creating an experimental design that captures these factors' interactions. 3. Efficient data summarization. Factorial analysis condenses large amounts of data into meaningful results, simplifying the complexity inherent in studying multiple factors at once. Example: in a study examining food preferences regarding healthy versus junk food, using factorial analysis helps summarize and compare preferences across different age groups and dietary habits. Types of factorial designs. 1. Full factorial design. In a full factorial design, all possible combinations of factors are tested. This allows researchers to evaluate the main effects and all possible interactions between factors. Example: if a study involves 2 factors, a full factorial design would include 4 groups of participants. Those studying for 2 hours with traditional teaching, 2 hours with interactive teaching, 4 hours with traditional teaching, and 4 hours with interactive teaching. 2. Fractional factorial design. In some cases, testing all possible combinations may not be feasible due to time or resource constraints. A fractional factorial design selects a subset of the possible combinations. This approach provides insights while reducing data collection efforts. Example: if there are 3 factors and the researchers cannot test every combination, they might choose a few key combinations to analyze. Conclusion: factorial analysis is a powerful statistical tool that helps researchers understand the relationships between multiple variables and how they influence outcomes. By examining main effects and interaction effects, researchers can gain valuable insights into complex data. Understanding how to apply factorial analysis will be beneficial for your studies and help you critically evaluate research as you prepare for your CPC exam. Sure, let's explore the concept of the chi-square test, which is a non-parametric statistical measure. This test is widely used in research to analyze categorical data. We will break it down into key concepts, important details, and examples to make it easy to understand. What is the chi-square test? The chi-square test is a statistical method used to determine whether there is a significant association between 2 categorical variables. Categorical variables are those that can be divided into distinct categories or groups, such as gender, favorite color, or type of car. The chi-square test helps researchers understand if the observed frequencies of data differ from what would be expected if there were no association between the variables. Key concepts. 1. Categorical variables. Categorical variables are attributes that can take on a limited number of values. These variables can be nominal or ordinal. Example: if you survey people about their favorite types of fruit, the responses are categorical. 2. Observed versus expected frequencies. Observed frequencies are the actual counts or occurrences of data in each category, while expected frequencies are what you would expect to find if there were no association between the variables based on a specific hypothesis. Example: if you have a survey of 100 people that list their favorite fruit, and 50 say apple, 30 say banana, and 20 say orange, these counts are the observed frequencies. 3. Contingency table. A contingency table is a table that summarizes the relationship between two categorical variables. The rows typically represent one variable, and the columns represent another. Example: gender apple banana, orange total. Important details. 1. Degrees of freedom. In the chi-square test, degrees of freedom refer to the number of categories minus 1 for each variable. This information is used to determine the critical value from the chi-square distribution table. Formula. For contingency table, the degrees of freedom can be calculated as df equals times df equals, where RRR is the number of rows and CCC is the number of columns. Example: in our gender and fruit preference table, there are 2 rows and 3 columns. df equals 12 equals 2 df equals times equals 1 times 2 equals 2 df equals 12 equals 2. 2. Calculating the chi-square statistic. The chi-square statistic is calculated using the formula chi2 equals 2 e2 equals sum frac 2 equals e2, where OOO is the observed frequency and EEE is the expected frequency. You sum this for all categories. Example: if you expect equal distribution among fruits based on preferences, for males, the expected frequency for apples would be E igual total mais total plus total respondentes igual 4550100 igual 22.5, E igual frac times teste igual frac igual 22.5, E igual total respondentes total mais total plus igual 1004,550 igual 22.5. You would then calculate the chi-square statistic based on the observed and expected values for each category. 3. Interpreting results. After calculating the chi-square statistic, you compare it to a critical value from the chi-square distribution table based on the degrees of freedom. If the chi-square statistic is greater than the critical value, you reject the null hypothesis, suggesting there is a significant association between the variables. Example: if your calculated chi-square statistic is 10 and the critical value at df equals 2 is 5.99, you would reject the null hypothesis. This means that there is a significant relationship between gender and fruit preference. Advantages of the chi-square test. 1. No assumptions about distribution. The chi-square test is non-parametric, meaning it does not assume a normal distribution for the data. This makes it versatile for many types of categorical data. 2. Easy to interpret. The results are straightforward to interpret, allowing researchers to quickly identify associations between variables. Limitations of the chi-square test. 1. Minimum expected frequency. The chi-square test requires that each expected frequency is at least 5 to ensure validity. If the expected frequencies are too low, the results may not be reliable. 2. Only categorical data. The chi-square test is only appropriate for categorical data and cannot be used for continuous variables. Conclusion. The chi-square test is a valuable non-parametric statistical measure for analyzing categorical data and determining associations between variables. By understanding how to use the chi-square test and interpret its results, you can effectively analyze data in various research scenarios. This knowledge will be useful for your preparation for the CPC exam and in your future studies. Parsimony, Occam's razor. Sure, let's explore the concept of parsimony, often associated with Occam's razor. This principle is an important idea in science and philosophy that helps guide thinking and problem solving. We'll break it down into key concepts, important details, and examples to make it clear. What is parsimony? Parsimony refers to the idea that the simplest explanation or solution, with the least number of assumptions, is usually the best one. When faced with competing explanations for the same phenomenon, parsimony suggests that one should favor the one that requires the least complexity. What is Occam's razor? Occam's razor is a philosophical principle that states that among competing hypotheses, the one with the fewest assumptions should be selected. This is often paraphrased as the simplest explanation is usually the best. It encourages the evaluation of ideas based on simplicity and the avoidance of unnecessary complexity. Key concepts of parsimony and Occam's razor. 1. Simplicity versus complexity. The core idea of parsimony is that a simpler explanation is preferable to a more complex one if both can explain the phenomenon adequately. Complexity can lead to confusion and misunderstandings. Example: if you hear hoofbeats outside, you might think, that sounds like a horse. A more complex explanation might be, that sounds like a horse, but it could also be a zebra escaping from a nearby zoo. While the zebra explanation is creative, the simpler explanation of a horse is more likely to be correct without any additional evidence. 2. Assumptions. Every explanation comes with assumptions. The fewer assumptions an explanation requires, the more likely it is to be accurate, according to Occam's razor. Example: if a scientist proposes a new theory about why plants grow taller in sunlight, they might suggest that sunlight increases growth directly due to photosynthesis. Alternatively, a more complicated theory might involve assumptions about the plants needing special nutrients carried in the light. The simpler assumption regarding photosynthesis is better according to Occam's razor. 3. Application in science. In scientific research, Occam's razor is often applied when developing theories and hypotheses. Scientists prefer theories that can explain phenomena without adding unnecessary elements. Example: when developing a model for why a certain medication works, a simpler model that directly links the medication's ingredients to its effectiveness is preferred over a complex model that includes numerous side effects or unrelated processes. Important detail. 1. Not always correct.